بسم الله الذي لا يضر مع اسمه شيء في الأرض ولا في السماء وهو السميع العليم صدق اللہ العظیم. شروع اس ذات بابرکت کے نام سے جس کی موجودگی میں دنیا آسمان و زمین کی کوئی شے انسان کو نقصان نہیں پہنچا سکتی. مالک کائنات کے حکم کے بغیر ایک پتا بھی نہیں ہل سکتا. تو لہٰذا اس بابرکت نام سے جب ہم شروع کرتے ہیں تو کام میں برکت بھی ہوتی ہے اور اس میں آسانی بھی پیدا ہوتی ہے. آج کا ہمارا ٹاپک ہے بیروٹراما. As it is apparent from the word barotrauma, baro means pressure of the air and trauma means trauma. The air pressure problem causing trauma to middle ear cavity, resulting in hindrance in the process of transmission of sound. So by definition, the barotrauma is the damage resulting to the middle ear because of inequality of air pressure on each side of the tympanic membrane. As we have already discussed in the previous lectures also, for normal functioning of middle ear, that is the transformer mechanism of middle ear, conduction of sound, we need normal air pressure in the middle ear cavity equal to environment. For this equalization of air pressure between the middle ear and environment, the function of pharyngotympanic tube or eustachian tube is very important. As we all know, we swallow after every few minutes, and with this swallowing movement there is opening of the eustachian tube intermittently, which maintains a normal air pressure in the middle ear equal to environment so that it can function normally. Disturbance in this mechanism can occur when the atmospheric pressure is raised and the active opening function of the auditory tube is inadequate, or the environmental pressure decreases and the function is inadequate. Both ways, the equalization of pressure on the two sides of tympanic membrane will be disturbed. Most of the time this occurs during air travel. You might have noted that in international flights, when the aircraft is ready to take off, you are given instructions about the flight, and also apart from that, the air hostess presents you a toffee so that you can chew it and suck it. This presentation of the toffee is not simply done as a fun, but it has got a definite function behind, and that is that when the aircraft is taking off, you perform the repeated act of swallowing because of presence of a toffee in your mouth. And this is important for normal function of the middle ear by repeated opening of the eustachian tube, because when the toffee is in your mouth, you will repeatedly perform the act of swallowing. Now this function becomes even more important during descent of the aircraft, because for anatomical reasons The pressure difference because of inadequate opening or non-opening of the eustachian tube is more disturbing during descent as compared to ascent of the aircraft. So, it is important to perform the act of swallowing, even more important while the aircraft is descending down. A person who is having some problem with the upper airway, flu or something like that, he should be even more careful for this purpose because he can have problem more than a normal person. If you don't have a toffee, you can yourself perform repeated act of swallowing, particularly during descent of the aircraft. This problem can also occur in deep sea diving underwater, and also in a compression chamber when the patient is receiving hyperbaric oxygen therapy. But this problem is more common in air flight. What happens is the patient starts feeling deafness in both the ears with pain which will go on increasing, and it may become severe pain. And deafness is conductive in type. When you examine such a case, you will appreciate there is retraction of the tympanic membrane and its mobility is decreased or lost. The deafness, which is conductive in type, can be easily confirmed by tuning fork tests, which can be performed anywhere comfortably. If the condition continues, the patient can have a perforation of the drum, and less commonly even the secretory otitis media and perilimb fistula, they are also included among its complications. The treatment includes local nasal decongestant drops. Now, this is one of the very important and positive use of local nasal decongestant drops. As we have repeatedly discussed, the strong local decongestant drops like xylosine, obviously because of decongestion, they are responsible for quickly opening of the eustachian tube, as they do this function in the nose also, causing opening of the nose. But this decongestant action, if it is repeatedly performed, it results in rebound phenomena and more blockage. But this is the condition where these local nasal decongestant drops, they are very useful. They will quickly reduce congestion and open the eustachian tube. Obviously, using these drops and trying to perform the repeated act of swallowing can solve the purpose of the patient in initial stages. To combat the pain, we can use analgesics, which are mostly analgesics as well as anti-inflammatory, like paracetamol, like Prof, etc. There are so many analgesics available in the market. They can be utilized for this purpose. And most of the time, you can also give the patient steam for inhalation, that also have the function of decongestion of the eustachian tube. But if this treatment does not work, the patient's condition is still worsening, there is persistent severe pain in the ear and headache, then you can go for myringotomy. By myringotomy we mean giving a nick in the tympanic membrane, a small incision in the tympanic membrane by a special instrument, myringotome, so that the air can easily enter from outside into the middle ear cavity, and a negative pressure which has been created in the middle ear, that is no more there. So this myringotomy is the surgical treatment when medical treatment fails. If such a patient has got a repeated problem like this and he has to travel frequently, then you might have to insert a grommet. After performing myringotomy, you can insert a grommet in that incision, which is a micro tube which will act as a secondary eustachian tube, equalizing the air pressure between the external ear and middle ear. This problem can be prevented easily if we are careful, as I have just mentioned, by performing a repeated act of swallowing during flight, during ascent and descent of the aircraft, particularly during descent. No doubt the modern aircraft, they are well equipped and they maintain the air pressure within the aircraft which is required for ideal situations. But sometimes there is some problem in the aircraft, or this function of the aircraft is not very good, and the patient is having some problem in the eustachian tube because of flu or something like that, then you can have this type of problem. Then Valsalva maneuver is another very simple procedure which can be performed in these situations in early stage during flight, by which you can save yourself from this problem. The Valsalva maneuver, that is holding the nose with your finger and thumb and trying to exhale while the mouth is closed. That will create positive pressure in your oral cavity, oropharynx and nasopharynx, and that can be transmitted via the pharyngeal end of eustachian tube towards middle ear cavity. That is very simple procedure which everybody can perform. Another preventive measure which you can take, that do not sleep during descent of the aircraft. Particularly during flight you can sleep, but when the aircraft is rising up or it is going down, particularly while it is going down, that is during descent of the aircraft, you should not sleep. You should remain awake and sitting upright. Nasal decongestant drops like xylometazoline or oxymetazoline, they can be utilized as a preventive measure also. If you have some problem, or you suspect some problem, or you have previous history of this type of problem during air travel, you can use nasal decongestant drops while you start your air travel. Grommet insertion we have talked about. When the myringotomy is done, the patient is having repeated problem like this, you can insert grommet tube for certain period of time as far as it is required. Then it can be removed after a few weeks. And have a look on this picture, ascent of the airplane and descent of the airplane, and how the tympanic membrane behaves and how the eustachian tube behaves. When there is high pressure in the middle ear, that will exude out from the eustachian tube towards nasopharynx. When there is low pressure, then the air will be traveling from the nasopharynx towards the middle ear cavity. And during descent of the airplane, as I have just told you, the problems can be more severe. So you have to be more careful during descent as compared to ascent. Thank you very much.